World Cancer Day is commemorated on 4th day of February. This year, we are commemorating it under the theme, Close the Care Gap. This is a day for us to take stock of the challenges that humanity is facing because of cancer, and also a day for celebrating our successes in supporting the people affected by the epidemic. It is also a day when we make a firm commitment to sustain the achievements of the country and do more, do better, and reach further for the eventual victory over cancer.
Today is World Cancer Day, and we've been running the same theme even from last year, closing the care gap, and even this year it's the same theme because care for cancer patients still has a lot of gaps, right from a person presenting with symptoms, getting the diagnosis done, and accessing treatment. And so it's our appeal that we all get involved in closing this care gap. You can do it by making sure you search for knowledge about cancer, because many people do not know enough about cancer, and also spreading the knowledge that you get to acquire. Here we talked a lot about cancer, and many people who have been here must have heard a lot about cancer. And for you who are viewing us, who are listening to us, you need to know that in Uganda we get 34,000 new cancer patients every year. And these are the ones that are documented, in our healthcare system. So you can imagine there are many others that are never documented. So just to know that we have over 34,000 cancer patients, new cancer patients every year. These are new cancer patients because there are more cancer patients than that. I think we have close to 60,000 cancer patients in Uganda. And when I was talking, I said that if you divided this number divided it to the number of districts we have, the number of some counties. You can even divide by the number of villages, and you see how many cancer patients are diagnosed every year in a single village. So the cancer burden is huge, and there's need for everyone to get involved. Prevention, early detection, and screening. And each one of us can. The commonest cancer in Uganda is cancer of the cervix. And cancer of the cervix accounts for over 20% of all cancers in this country. So we have about 6,659 women diagnosed with cancer of the cervix every year, only 1 year. So you can imagine, those are huge. That's a huge number. Those are many. Yet, cancer of the cervix is a cancer we can prevent by vaccinating girls who are 10 years, by screening every woman who is 25 years and above and is sexually active. We can detect this cancer in its pre-cancer phases, treat it and cure it, so that this woman does not have to suffer from cancer of the cervix. The second cancer in Uganda is Kaposi sarcoma. Kaposi sarcoma is cancer that mainly manifests in the skin, but it also affects lungs, it affects intestines. The risk of suffering from Kaposi sarcoma is increased by HIV infection. And as I said, if we make sure that people who have HIV receive the right treatment, they take their drugs as recommended, we actually reduce the incidence of this cancer called Kaposi sarcoma. And so if you are HIV positive, you know somebody who has HIV positive, or you do not know your HIV status, make sure you get the right care. Get tested. If you're positive, get treated. You will not suffer from this cancer if you adhere to your treatment. The benefits are enormous. Now, the third cancer is cancer of the breast. Cancer of the breast affects men and women. Now, many people think that cancer of the breast is a cancer for women only, but I want to tell men who are watching us, men who are listening to us, that also men can suffer from cancer of the breast. As a matter of fact, at Uganda Cancer Institute every year we have about 40 men, new men with breast cancer. And in the world, breast cancer accounts for 1%, breast cancer in men accounts for 1% of all breast cancers in the world. So just to know, and yet, breast cancer is a cancer we can screen for. You can learn, if you're a woman, how to examine your own breasts. And then if you find something that is not normal, I'm not talking about a swelling in the breast, anything that is not normal, bring it to a health worker. The health worker will assess and examine you. If it's cancer that is starting, they will be able to make a diagnosis, begin treatment. Because cancer of the breast is a curable cancer. We have
so
very,
is it a
very
new
many
case for men?
survivors.
Breast cancer, is it a new phenomenon in Uganda for
No,
men?
no, no. Breast cancer has been around. As a matter of fact, the very, very first writings of cancer that were done in Egypt, you know, in the civilization of Egypt, on papyrus reeds, were actually breast cancer notes. I had the chance of discovering them, and they're actually pointing at breast cancer. So cancer has been part of humanity. Only that, you know, we are discovering more and more and more about it. And of course in Uganda the awareness is still low, but it's on the increase, and we thank the media. I'm very, very, very grateful for the media that you've focused on cancer and you've increased disseminating of this information so that people know. But I want to appeal to people, knowing is not enough. Come, we check you for cancer. I say checking for cancer takes about 10 minutes. Checking for cervical cancer is like 5 minutes, you're done. And you know your status. So we all need to know our status. Now, the fourth cancer is cancer of the prostate, which is the commonest cancer in men. Prostate cancer, testing for it, we do a blood test. Now, a blood test that we do at a facility like Nachifuma here is a qualitative blood test, where we get the blood, we put it on a strip, and then we say positive or negative. Those who are positive, we send them to bigger hospitals to confirm whether indeed there is cancer or not. Because when you screen, we are not making a cancer diagnosis. No, this is a screening test. When it's positive, it means that there are high chances that this person is likely to have cancer. We send them to a bigger hospital. We do now diagnostic tests and confirm. And as I said, the capacity for cancer treatment in Uganda is now super. It's top notch, like our director usually says. We have the linear accelerator. There are only 2 linear accelerator machines in this country. One at Aga Khan in Nairobi and one at Uganda Cancer Institute. And our linear accelerator is the latest technology. So there are many men we are now treating for prostate cancer without doing surgery, without compromising their sexual function. We treat them as they are. Because many men say, when you remove my prostate, I will not remain sexually active. And they shy away. And they only come when it's too late. And we can only give them bad news. So thank you very much for watching us, for listening to me. Make sure you take this message into action.
Okay. Well, thank you so much. My name is Dennis Olodi. I work with Uganda Cancer Society as Executive Director, and also on this planning, I'm the Chairperson, National Planning Committee for World Cancer Day. Uganda Cancer Society is a coordination network of more than 41 NGOs operating in Uganda, some at Africa level and some in Europe. So we coordinate towards effective cancer control in Uganda. We could work in the areas of advocacy, awareness raising, training, that is capacity development, supporting patients, that is cancer patients, and research in the area of cancer. So as a lead civil society in the area of cancer, we have led the national planning, working in collaboration with the Ministry, Uganda Cancer Institute and Rotary to plan World Cancer Day. World Cancer Day globally is commemorated on 4th February. This year it's being commemorated under the theme, Close the Care Gap. What do we mean by close the care gap? You understand that cancer services in the country are clearly centralized. Not only that, financing is limited, human resources, we have that gap. Then in terms of policy and programming for cancer, we don't have a national cancer control plan. And yet, the World Health Organization recommends that member states must have what we call National Cancer Control Plan. National Cancer Control Plan will spell out at what levels within the health system cancer services are supposed to be offered. Right now, we don't understand. When you go to a health center 2, go to a health center 3 in some places, actually across Uganda, every health center 4 has a cancer clinic, but many of them are not functional. So the National Cancer Control Plan is supposed to spell out that. How do civil society organizations come in? Because today, a family will just decide to do cancer screening. Suspected cases, they don't refer. So even when WHO releases, like the latest report that we have is for 2020, that about 33,000 cases, 32 I think, 1,000 cases were registered in Uganda. And out of that, we lost 22,000. Those are registered cases, but we have very many people in the countryside who do not have access to the only national treatment center, which is Uganda Cancer Institute. Yes, government has efforts around decentralizing services to Gulu for northern Uganda, Mbale for eastern Uganda, Mbarara for western Uganda, then Mbale, Arua for West Nile. But that is still not enough. Apparently, we have the cancer unit in Arua functioning, offering some services. Mbarara cancer unit is offering some services, but we still have very many gaps. The health system cannot support. Right now, the institute handles very, very many patients, and it's even worse when it comes to cancer in children. Only 10% of the cases registered in Uganda are handled by the Cancer Institute. So it means majority of these children remain in the villages. So it's a very big challenge. So on a day like World Cancer Day, we make a clarion call on government to ensure that in addition to decentralizing cancer services, they should expedite the adoption of National Cancer Control Plan. We are aware that the WHO has supported in terms of providing a consultant to help with the costing. It is now incumbent upon the Ministry of Health top management and cabinet to have the process of its adoption and implementation expedited. Thank you so much.